Swaziland, I am the only person currently who is practicing medical aesthetics. Yes, men do come as well, and I will say they are one of my best clients. So just after 3 sessions of doing PRP microneedling treatment, we have achieved really beautiful results. He's very confident now. He's on to the next treatment, which he says that he wants braces. He's happy. He's very confident about how he looks. Can we please do not go around preaching about toothpaste on pimples? Oh, there's so many. Egg yolks help with anti-aging. Hi, I am Dr. Bongiwe Shongwe, a General Practitioner with special interest in medical aesthetics. My journey in aesthetics is very funny because it all started by curiosity to see what this world of aesthetic, what this buzz about, especially post-COVID. So what inspired me is seeing that you can do minimally invasive procedures to get somewhat of similar results that you can get with plastic surgery. The biggest misconception people have about medical aesthetics, first of all, is that a lot of people do not believe that it is part of medicine. So some clients will be coming, are you a doctor? What are you here? Because some things, because it's more of beautification, it's more of cosmetology. So a lot of people do not believe that it's related to medicine. However, the biggest misconception is that we give people big lips. Yeah, they look like ducks, especially when we do fillers. Based on our demographic, a lot of my patients look for treatments that have to do with pigmentation issues. So that is the most requested treatment within my practice. Aesthetic consultation usually looks like a client usually makes a booking, they come in and we sit down. So history taking is very, very important because number one, it leads me to understand the client's condition, and also thereafter we focus on what the client is basically looking for out of their treatment. So we sit down, we discuss the possible treatments that we would probably do on that client, and also to see and then we also discuss options that would be best for that specific client for that condition. A lot of clients usually also raise concerns, especially cost-wise. Then we can curate something based on their budget as well. Well, in Swaziland, I am the only person currently who is practicing medical aesthetics. However, because of exposure with our neighboring country, South Africa, we've seen a lot of spas which are not licensed, or rather practitioners that are not licensed to do these practices, offering it to clients even at a much cheaper rate using fake products. So those are the things that we have seen, especially in South Africa. You're going to get certain injectables done by a therapist or done by a somatologist, yet it needs to be done by a doctor, or having something done in the back street. Oh, men are my favorite in the sense that when they come for treatments, they're usually very, very committed to the therapy, because they usually have major concerns. So yes, men do come as well, and I will say they are one of my best clients because they really do follow instructions, and also they adhere to, they also follow also on their appointments. So I appreciate the men that come through. Yeah, it's not very common, but they are 10% of them make up men, and then the 90% are females. Actually, I do have a mom. When I first met her, she discussed and we spoke about how you know, what treatments that she wants, what she desires, but she has this guilt that, oh, I can't be using my money on myself. Every time I get a little bit of money, I'm thinking about my kids. So a lot of women usually have that guilt behind it, and I'm like, listen, you're a mom, I understand, but you also need to feel confident in what you're in. So we usually talk about self-care and the importance thereof, because these things, you lose self-confidence, especially after being a mother. So many changes happen on your skin, on your body. So you need to have that confidence booster with these aesthetic treatments. This is what these aesthetic treatments basically provide. So yeah, we just sit down, we discuss, because also aesthetic treatments have a huge role on the psychological aspect of a client. There's no one who has come in and complained about overdoing a treatment. For example, I am overdoing filler, because usually that's the most common treatment that people get done. You come in, you'll be like, oh, I want to enhance my lips, for example. And we put filler onto your lips. Then 2-3 weeks later, once the swelling has gone down, you're like, oh no, the filler, it doesn't look good anymore. I want more plumping. So you find that in those cases, people can feel then guilty later to say, oh, I think I did a bit too much. But also the great thing about aesthetics, some of the things are reversible, especially when it comes to filler. We can always dissolve the filler and then we start again. So yes, can we please do not go around preaching about toothpaste on pimples. It's better to buy pimple patches which have got salicylic acid or tea tree oil in them that will help with your pimples even much better. Confidence comes with a person looking good or feeling good about themselves. When you stand in the mirror and you look at yourself, and let's say you wear a certain outfit, or you have changed your hairstyle and you look a certain way, you feel good. By the moment you walk out of that house, the way you talk to people, the way you interact with people, that already boosts your confidence. So in aesthetics, we find that a lot of people have got certain, it can be small, others can be big, concerns for them, and that has to deal with their confidence. So they feel less confident when they're looking at people. The most thing that I've seen is women covering themselves in makeup, heavy makeup, each and every day, because there are scars that they're hiding, there is pigmentation that they're hiding, or some people will be using contour or something with their makeup, or what you call blush, just to distract, to make people look away from their concerns. Others will be wearing weaves because they cannot go out with their hair because there's issues of alopecia. So all of these things, they have to do a lot with the person's confidence, that they have to mask how they look. And then people will be like, oh, you're always on makeup, or you're always wearing weaves, but there's actually underlying issues with that person. So it does have a lot to do with bringing back that person's confidence, being able to walk out and without makeup, being able to walk out and not feeling like you're too big, not feeling like you have to hide something. So yes, that's where aesthetics plays a role. In medical aesthetics, within the clinic group, we offer a wide range of advanced treatment. One very popular one is platelet-rich plasma, which has got more regenerative, it helps more with regeneration. That helps with more of scars. It can help also with hair growth. Other treatments that we have is using a cryopen that helps freeze basically certain lesions on the skin. And also we have what we call a plasma ablaze pen, which helps remove skin tags. It can help with skin tightening more around the eyes, and especially with aging signs. And it can also help with tattoo removal. So then also we've got fillers, we've got Botox. Botox specifically as an advanced treatment. We use it more for issues of hyperhidrosis. It can be either under the armpit, your hands, the palms of your hands, or the soles of your feet. That helps with excessive sweating basically. Those are the treatments I can recall right now. Oh, also there's exosomes, which also help with scar and hair growth as well, with scar healing and hair growth. I'm really proud to be working at the clinic group where they basically introduce practices that we see in first world countries, and they introduce them into the country to make sure that these services are provided without having to go far and wide. With the clinic group, what is very nice about having medical aesthetics is that you've got practitioners that are licensed with a medical background that provide safe and effective treatments. So we use what we call the Fitzpatrick scale, which basically has got different skin types. So skin type 1 being the much fairer Caucasians, and then Fitzpatrick 6 being the darker skin type. So it is important to know what kind of skin type you're working with, because some of the treatments that we use in clinic are not suitable for the darker skin types, because those ones are more prone to scarring, they're more prone to pigmentation, so it is important to take caution. So history taking is very important, and also the type of drugs and also treatments that the client has done is very important for us to take note of, so that we know what it is that we use. So I also ensure that the products that I stock in clinic, they are safe for all skin types. I will talk about a 13-year-old boy that I started seeing he's not 13, 15. 15-year-old boy that I started seeing last year. First of all, he presented with issues of cystic acne, which was very, very bad on his skin. His mother had said that he had tried taking him to spas whereby he would do facials, but nothing happened. So she decided to give me a chance last year. So we first treated the boy's acne, and then later, earlier in the year, he developed, he then had, the pimples were gone, the acne was gone, and all that was left was pitted scars on his face. So just after 3 sessions of doing PRP microneedling treatment, we have achieved really beautiful results. He's very confident now. He's on to the next treatment, which he says that he wants braces. He's happy. He's very confident about how he looks. Before, he had his friends laughing at him, and I'm really happy about how the results came out. What patients are really afraid of is needles when it comes to my services. I use a lot of needles. So I do try to reassure them that this is not invasive. It is, we anesthetize them to make sure that they don't feel pain. We talk them through if there's any pain that they feel. I reassure them as we go. We discuss about their pain tolerance, and then as we discuss and talk throughout the treatment, the client then has more confidence in me. So it's more about talking and reassuring as we are doing treatments, as we are discussing. And funny enough, one client that I started seeing last year was very afraid of needles, still is, but is the one client who is always saying, when is my next appointment? When are we injecting? I am coming. So it's that good relationship, that trust between the doctor and the client, that is built, that gives the client confidence in what we do. Results are the most rewarding part of my job. This morning, I just saw a client that I had done filler on a couple of weeks ago, and I was just so happy. The other one, I did filler under the eyes. I was really happy. So it's really the results that we see that makes me excited. Aesthetics is still very young, but I see it going very far in Eswatini. Introducing laser treatments, which I am looking forward to, introducing other treatments that seem to be far-fetched. A lot of people traveling to other countries like Turkey or going to South Africa to have these advanced treatments done. I see them being provided within the country, and for us being the center of all our neighboring countries that are there, and also the neighboring towns within these neighboring countries. The worst thing about practicing medical aesthetics is that I go around, okay, a person can come and sit in front of me or can chat with me, and I'm thinking to myself, oh, you need Botox, oh, you need, I would like to do this on you, I'd like to do this. And not that that person is imperfect, but it's just like, oh, this would look nicer if we could add this or we could do that. So yeah, that's the worst thing I can say about aesthetics, is that you're always curious, or you always want to do something to someone that you meet. So you need to be like, okay, let me hold myself back and not say anything. The piece of advice that I would give to somebody who is looking to do their first treatment is to do research, so that whatever myths that they have, we can be able to debunk. And also their concerns, because then a lot of clients can come and say, oh, I've now experienced this, this is what I've read up, coming post the treatment, and yet we haven't discussed what are the possible things. But however, even within the clinic, before we start treatments, we usually plan. I usually don't do treatments within our first session. We always plan, we discuss, and then we plan to book our next treatment following. But I always ask clients to say, hey, please then go read on this. When you come back, you can come back and ask more questions, so that it will be easy for me to answer, and also to build that trust between myself and the client, and to make it easier. Final advice is acceptance is everything. I used to also be somebody who I also used to be somebody who was insecure about myself. There are some insecurities that I do walk around with. Nobody is 100% perfect. Perfection is a lie. And what I would say is that be confident in what you have, and also beauty is highly subjective, and you're the only person who can tell yourself that you're beautiful.